Perfect, Ramon. Here are 3 USMLE-style high-yield questions focused on Hurler syndrome, a mucopolysaccharidosis type 1. These questions test your understanding of the clinical features, enzyme deficiency, substrate accumulation, and how to distinguish it from similar disorders. Question 1. Classic clinical presentation and diagnosis. A 1-year-old boy presents with developmental delay, coarse facial features, macroglossia, hepatosplenomegaly, and clouded corneas. He also has recurrent upper respiratory infections and skeletal deformities. What enzyme is most likely deficient? A. Iduronate 2 sulfatase, B. alpha-L-iduronidase, C. Aryl sulfatase A, D. Alpha-galactosidase A, E. Hexosaminidase A, B. Alpha-L-iduronidase. Explanation. Hurler syndrome is caused by a deficiency in alpha-L-iduronidase, leads to accumulation of heparan sulfate and dermatan sulfate, presents with developmental delay, clouded corneas, hepatosplenomegaly, skeletal abnormalities, dysostosis multiplex, coarse facial features. Why not the others? A equals Hunter syndrome, X-linked, no corneal clouding. C equals metachromatic leukodystrophy. D equals Fabry disease. E equals Tay-Sachs. Question 2. Substrate and pathophysiology. What accumulates in tissues in patients with Hurler syndrome, leading to progressive organ damage? A. GM2 ganglioside. B. Sphingomyelin and cholesterol. C. Heparan sulfate and dermatan sulfate. D. Galactocerebroside and cyclosine. E. Ceramide trihexoside. Correct answer, C. Heparan sulfate and dermatan sulfate. Explanation. Due to alpha-L-iduronidase deficiency, glycosaminoglycans like heparan sulfate and dermatan sulfate accumulate. These build up in connective tissue, cornea, airway, and organs, leading to multisystem symptoms. Why not the others? A equals Tay-Sachs. B equals Krabbe. E equals Fabry. Question 3. Differentiating from Hunter syndrome. Which of the following findings helps distinguish Hurler syndrome from Hunter syndrome? A. Hepatosplenomegaly. B. Coarse facial features. C. Accumulation of glycosaminoglycans. D. Clouding of the cornea. E. Skeletal abnormalities. Correct answer, D. Clouding of the cornea. Explanation. Hurler syndrome includes corneal clouding. Hunter syndrome, also a mucopolysaccharidosis but X-linked, does not. Both have coarse facies, developmental delay, and gag accumulation. Why not the others? A, B, C equals shared by both Hurler and Hunter. D equals the key distinguishing feature.